My name is Dr. Hillel Mazansky, and I specialize in medical hypnosis, guided imagery, nutrition, and exercise. My website being drdrmedicalhypnosis.com for your personal hypnosis and nutrition and exercise videos. Today I'm going to speak about something that's extremely common. And you get the question all the time, Doctor, why am I so tired? This condition tends to appear more in females than males. They go to the physician and he does $1,000 blood workup and can still find nothing. So the patient says, well, doctor, what's wrong with me? Is it in my head? To which I answer, no, it's in your mind. And we'll explore this a little later. So, it is imperative that one gets a good night's sleep, because not having a good night's sleep and interrupted sleep makes you tired the next day. The next condition is called sleep apnea. Sleep apnea is a condition where the roof of the mouth falls and closes off the trachea, and at that moment the patient stops breathing and semi-wakes up during the night. Not completely, but wakes up. And those are called hypopneas. And when they can stop breathing completely, and that's called apneas. Now, when you have this condition of sleep apnea, the next day you are very tired because you haven't reached the so-called REM sleep, rapid eye movement sleep, and you tend to be extremely tired, falling asleep at the drop of a hat. If you're driving in a car, if you go to a movie, anything where you sit for a while, you can go to sleep. So sleep apnea must be thought of in the back of the mind, and the physician should be encouraged to do a sleep study which diagnoses the condition. And if you do diagnose the condition, then you are prescribed a sleep mask and the condition improves. Next cause of tiredness and lassitude is anemia. Again, this tends to be more common in females than in males because the females have the menstrual cycle. Menstrual cycle causes loss of blood, and when you have a loss of blood, that tends to affect your energy, and you tend to be drowsy and sleepy. The most important cause for persistent tiredness and lassitude is depression. You can exclude all the others, and you must try and elucidate if the patient suffers from depression, because that is the number one cause of, oh, doctor, I feel so tired. Is it in my head, doctor? Doctor, no, it's in your mind. And for depression, we have special videos for depression to treat the patients with hypnosis, nutrition, and exercise. There is one at drmedicalhypnosis.com. So that's depression. The next cause is not a very common cause, but it's called Lyme disease. Lyme disease is a result of being bitten by a tick, and it tends to be more in the East Coast and Midwest than it is in the South. And treating that can be rather a daunting situation, as it doesn't always respond to normal treatment. Another cause for lassitude or tiredness is hypothyroidism or underactive thyroid. Thyroid gland is the thing that keeps you going, gives you energy, keeps your metabolism high. But in this case, when you get hypothyroidism, it causes you to become overweight and you feel tired all the time. There, it is important to have the blood test and make sure that your thyroid is functioning well. You know how patients always say to me who are obese, "Doctor, I've got a glandular problem." Well, the only gland problem that a person can have that leads to obesity is the thyroid gland. Another cause of obesity, I mentioned, can be the menstrual cycle, but in pari passu with that is urinary tract infections in females, or UTIs. They don't have the classical symptom of burning and frequency, but they present with mainly being tired. And the only way that you treat that is to go to the doctor, let him or her take a urine sample and see if an organism is grown. And the organism grows, then you treat it. There you treat it with an antibiotic. Another cause for tiredness or lassitude during the day is that people don't eat a good breakfast and not a good lunch. I always make the analogy that if you own a car and you want the car to go well, it is imperative that you put in oil and gas. Well, think for a moment. We could be that type of car, but our oil and gas is our food. So always eat a good breakfast, especially a good breakfast, and have a mid-morning snack to make sure your metabolism is kept revved up, and that will lead to weight loss if you have 5 small meals a day. So that's the urinary tract infection. Another cause that is very scarce, actually, and very rare is that of Lyme disease. Lyme disease can cause as a result of a bite of a tick, and tends to be more in the area of Connecticut, Maine, and part of the Midwest, but we don't see it here in the West Coast. So that can also take a long time before it's diagnosed and treated with antibiotics. Diabetes. Diabetes, when the blood sugar is out of control, that can also cause the person to be tired all the time. In the same way, people in heart failure, their heart doesn't function well, and that leads to constant tiredness. So it is important to make sure that the person doesn't have heart failure. The last and most probably most typical form of chronic tiredness or chronic lassitude is the chronic fatigue syndrome. This is a syndrome that is very debilitating, comes mainly in females, and they are constantly tired. They sleep the whole day, they sleep the night, but they're tired when they wake up. They're tired when they go back to bed. They have sweats and enlarged glands. Together with that, fibromyalgia can also be the cause of chronic fatigue and lassitude. There is a video on the site at drmedicalhypnosis.com for treating patients with hypnosis and nutrition. The next cause is insomnia. You can imagine, if you can't sleep, then the next day you are constantly tired, you cannot function. So we recommend for insomnia that you wear dark glasses at night, you don't have the TV blaring, you can listen to some music which is very soft, have the temperature of the room correct, and do not take medication, because medication has toxic side effects. But I promise you, folks, if you listen to the insomnia video, you will be asleep halfway through. So that's about the most important causes of lassitude or feeling tired. Just a note before I leave, I would like to welcome all our new friends at Pinterest. This is a great social media site. And for those of you, especially overseas, who haven't heard of Pinterest, I think you should join. I have, and it's great. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.